October is Breast Cancer Awareness Month, and today we're talking about how it ties in with fertility and the options survivors have when it comes to preserving their eggs. Joining us are Doctors John Fraterelli and Anat Carmone from the Fertility Institute of Hawaii. Aloha to you both. Mahalo for joining us.
Aloha, thanks for having us.
Yes, so the first question we're going to ask is, how does a typical treatment for breast cancer really affect when it comes to fertility?
So the good news is that breast cancer survivors are living longer and longer. We have excellent therapies and treatments for breast cancer. However, some of these therapies can be quite toxic to the ovaries and can leave women having some trouble getting pregnant later on. The good news is that there are some treatment options in order for them to preserve their fertility ahead of time. There are some other therapies as well, for example, tamoxifen and other anti-hormone therapies that women might have to take throughout their treatment, which would also prevent pregnancy as well.
And you're talking about the common treatments for cancer like chemo and radiation, right?
Correct.
So what options are available once a woman is diagnosed with breast cancer?
So once somebody's diagnosed with breast cancer, they oftentimes will come in for a consult, and we're able to see them within 24 hours of getting a referral for them. So we'll talk with them about what their options are. The biggest option really is preserving their fertility, and typically they have to make that decision fairly quickly, unfortunately, because they're getting ready to undergo treatment. And so that really starts with doing egg freezing typically for most patients. So they're going to undergo an IVF cycle where we would get eggs and freeze eggs. And with this new technology called vitrification, which really has only been perfected in the last 10 years, we're able to freeze eggs with the same fidelity that we can freeze sperm and freeze embryos, and it doesn't decrease the reproductive competence of those eggs. So those patients can now use their eggs in 5 years or 10 years or whenever they want and preserve their fertility for where it is right now.
Wow, that's some useful information for those who don't know. So if a woman's not able to preserve the eggs for later use, are there any other options if she still wants to have a family after treatment?
There are some options as well. During treatment, some women can use a medication called Lupron to kind of shut down the ovaries and prevent damage to the ovaries. And then there's, of course, the option to use egg donation in the future as well. If, for example, she doesn't have the time prior to chemotherapy to undergo egg freezing.
Okay, wow, very useful information, definitely. Thank you both for joining us today. Of course, we have all this information posted up on our website as well, hinowdaily.com.
This segment is sponsored by Fertility Institute of Hawaii.